Most people have physical pain now and then, like a headache or a backache, and it's usually temporary. But my next guest, Mike, has lived with chronic pain for over 10 years. His back, neck, shoulders, hands, and knees are riddled with osteoarthritis. So how does he keep going? Well, take a look.
I suffer from chronic pain all over my body. The more I do, it just intensifies. I definitely live a life in pain every day. I still do physical activities just to stay loose so I don't tighten up.
I don't think about how bad it hurts until, like right now, they're killing me.
I really wish Mike could help me, but he just doesn't feel good.
I don't like watching Jenny do the things that I should be doing. That hurts. It shouldn't be that way. My chronic pain has limited my activities with my family, and it's made it difficult to be the person I want to be. It's made it hard, really hard. I'm not going to let pain decide what I do and who I am. Chronic pain, it's part of my life, but it's not my life. Nobody asks for chronic pain. It's not fun.
Well, Mike is joining me along with my good friend from Pfizer, Dr. Freda Lewis-Hall. So welcome to you guys. Thank you so much. Mike, I do feel you, I promise. Rather than give in to your arthritic pain, you just keep moving. What keeps you motivated to fight back against it?
Well, a big part of that is my family. My amazing wife, and I've got a house full of teenagers, so they obviously keep me very busy.
Well, Dr. Freda, a lot of people suffer varying degrees of pain. Talk about the medical definition of chronic pain.
So chronic pain is pain that persists for 3 months or longer. Now, it can affect you 24/7, or it can come in waves of varying intensity. About 100 million, or 1 in 3 Americans, live with chronic pain. That number is more than people who live with heart disease, diabetes, and cancers combined. And some of this pain is linked to known underlying medical conditions like diabetic nerve pain, chronic low back pain, fibromyalgia, osteoarthritis like Mike has. But some chronic pain is linked to health issues that are just not on our radar. So it is so important for people to talk to their doctors about their pain.
Well, as I well know, chronic pain affects how people function beyond just the physical. So let's talk about that a little bit.
Yeah, so absolutely. Pain can affect a person on many, many levels. It can affect them mentally, as you know from all of your work. And that mental impact of just thinking about the pain all of the time can lead to other emotions like frustration and anger. And not being able to do simple things or seemingly simple things in your life, things that make you happy, like taking a walk outside or participating in family events, can really lead to this debilitating cycle of physical and emotional suffering.
Yeah, and you've had to manage that as well, right?
Sometimes it gets very frustrating, doing the things that I used to love doing, golfing with my buddies or just jumping on the trampoline with my boy.
Doctor, we know that chronic pain is a complicated health issue, so break it down for us because it involves a lot of symptoms.
It's actually, just by nature, an individual and subjective experience. So everybody's experience with pain is unique. And that means that there isn't one treatment that's right for everyone.
How would you suggest that chronic pain sufferers improve that communication with their doctors?
Well, there are a couple of things that happen with pain that also make it complicated. For example, pain is often not visible, so people can't see it, and therefore it's often misunderstood. And talking about the communication, sometimes it's really difficult to communicate pain even to your doctor or to your loved ones. The important thing to do is to be honest with your doctor. Be as specific and accurate in describing your pain. How does the pain feel? When does it occur? What makes it better? What makes it worse? And be sure to include the ways in which your pain affect your life completely, physically, emotionally, and socially. So don't just treat it like a number on a scale. And that will allow your doctor to have a better understanding and maybe figure out what type of chronic pain you have, and then to develop a treatment plan or a pain management strategy that is really focused on you and what your goals and what your needs are. So be sure to track your progress and report that information back to your doctor.
So to learn more about chronic pain and find tips to managing it, I recommend that you go to gethealthystayhealthy.com.
While you're there, you can download a chronic pain questionnaire and sign up for the newsletter.
Yeah. Look, I want to thank all of my guests today, especially Dr. Freda Lewis-Hall.